Hello, everyone. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome. Welcome to another CBT Guideline Mastery session with AMCI. How are you all doing, coders? Let me know in the chat. How are you all doing? And am I audible? Is my mic good? Please do let me know in the chat so that I can continue. Awesome, awesome. Hello, Sophia. Hi, a user Sherry. Hi, everyone. How are you all doing? So, I'm always thank you for letting me know. Thank you. Hi, Star Wars a girl. Hi, Chakan. Okay, so Codus, I am always excited for the Fridays. Yes. So, welcome back, everyone. We are going to continue strengthening our understanding on the CPT guidelines, not just memorize the codes, but truly mastering the concept behind them. So, in this session, we will break down the complex topics into the simple logical steps, connect the guidelines to the real exam scenarios, and also focus on the kind of details that make the difference between getting a question right and second guessing yourself. So grab your CPT manuals, keep your notes ready, and stay engaged because we are going to learn something good today. Okay, so let's begin by reading out the copyright. CPT Copyright 2026, American Medical Association, all right reserved. CPC is a registered trademark of AAPC, and the AAPC content found within this presentation is a copyright of AAPC. The keyword concept FTR, CHON, AMCI, FAB7, AMCI ICD-10 Flip Tab, and MCG are the trademark of AMCI. The credential CPCC, RCCOC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials, and the credential CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credential. Hi, Miss Veena. So I can see people are still joining. Welcome, 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 everyone. So today we are entering one of the most technical, detailed, and concept heavy areas in the CPT manual. Yes, I am going to talk about the radiation oncology. All right, so the radiation oncology services are found in the CPT section 77261 to 77799, and this can be found under your radiology chapter. So unlike many surgical chapters, you will find in this section that this is highly structured and divided into multiple components, right? So you can see under in the screen itself, you can see it includes a radiation oncology. Under the radiation oncology, it includes a consultation, clinical treatment planning, medical radiation physics, dosimetry, etc., etc. So, what are we going to do is that we will go through each one of them individually and we are going to learn about them as well. All right. Okay, so let's begin with the basics. What is a radiation oncology? So you can see radiation oncology is a medical specialty that uses high energy radiation to treat cancer. So you all know that there are different ways to treat cancer. Cancer can be treated by surgical method, chemotherapy, and radiation therapy is one other such way or such method to treat the cancer, right? Yes. So here a high energy radiation is used, and in some cases it can be benign, it can be non-cancerous or conditions. So instead using scalpel like in surgery or medication like in chemotherapy, we use carefully controlled radiation to treat the disease. Now let's simplify the science behind the radiation therapy. So radiation works by damaging the DNA of abnormal cells or the tumor cells. So when the DNA is damaged, those cells cannot grow, divide, or even multiply. Yes, that's how cancer cells are destroyed using radiation therapy. And cancer cells are more sensitive to the radiation than the normal cells. So over the time, these cancer cells shrinks or they are even destroyed, while the normal cells will recover better and they will grow again. All right. So radiation can be used to cure the cancer, control the tumor growth, or even reduce the symptoms. Now, let's talk about two major type of radiation therapy, and we will be discussing about the coding part as well. So, first one is a teletherapy. Teletherapy means radiation beams comes from the machine outside the body. It is usually from the linear accelerator. So, machine will aim the radiation beams at the tumor from the outsides. So, nothing is placed here inside patient's body. For example, you can take the case where a patient with breast cancer who receives the external beam radiation to the breast, right? So let's move on to the next type, that is brachytherapy. So you can see it means internal radiation. So brachytherapy is different. Here the radiation source is placed inside the tumor or sometimes very close to the tumor. So radioactive materials, may be temporary or permanent, is often inserted into devices like applicators, and they are placed near or inside these tumors. So you can see in the image, this is an example for a case of a prostate cancer. So in the prostate brachytherapy, tiny radioactive seeds are implanted directly into these prostate glands, and these seeds stay inside the prostate and delivers the radiation locally. So this will also helps to minimize the exposure to the surrounding tissue. So that's a two different types of radiation therapy. All right. Now, to really understand the radiation oncology coding, we need to see the bigger picture. So let's divide the radiation therapy process into clear phases. And these phases actually mirror patient's journey as well. So we begins with the initial consultation where the patient will meet the radiation oncologist. Then we have clinical treatment planning. Now, the radiation, this is where the radiation is decided. Physician will design the strategy. All right. And then comes the stimulation part or simulation part, sorry. So before delivering the treatment, we do a practice setup, and that falls under simulation phase. And this is followed by medical radiation physics, dosimetry, treatment device, etc. So here it involves dose calculation and all those physics activities. Okay. And next phase is the radiation treatment delivery. So while so this is actually where the delivery of the radiation happens. And finally, we have radiation treatment management. And while the treatment is going on, physician will monitor the patient. So let's go ahead and look into each of these phases individually, beginning with the consultation or clinical management. All right. So before any radiation therapy, the radiation oncologist sees the patient. And this visit is called the primary or preliminary consultation. And during this visit, doctor will review the medical record, a doctor will check the imaging, examine the patient. So we usually builds this visit with the ENM code, the evaluation and management codes. Or if needed, we might use the codes from the medicine and the surgery section as well. So this is the first phase, that is the consultation phase. Now we are moving on to the next phase. Okay, this is clinical treatment planning. Now, this is process is highly complex service where the physician will have to determine the location of the tumor. He have to determine the treatment volume, the dosage, the modality, and the number of treatment ports, etc. So we categorize these planning into three levels. That is simple, intermediate, and complex. So these are the three levels of clinical treatment planning. Okay, so all right. Now you might ask, okay, let's begin with the simple planning. Simple planning requires just a single treatment area or one to two simple pods or minimal or no blocking. Now here you might ask, what is pod? So pod is simply the direction from which radiation enters the body. So think of it like this. If the radiation is coming from the front, it is called as one pod. If the radiation is coming from the back, it will be another pod. If the radiation is coming from the side, that can be also considered as a pod. So each beam direction equals one pod, right? So if the treatment uses the front and back beams, then you can say there is two pods involved. All right. Yes. So intermediate planning steps up. That's the next level. So intermediate planning requires three or more ports or two treatment areas or multiple blocks or simple time dose constraints. So those are the requirements to fall under intermediate planning category. And last, we have complex planning that is coded with 77263. So this requires three or more treatment areas or three plus treatment areas, tangential or rotational beams, custom shielding blocks, wedges or compensators, combination of modalities. All right. And the simple planning is coded with 77261. Intermediate is coded with 77262, while the complex is coded with 77263. So these are the three types of clinical treatment planning. Now let's move on to the next phase, the third phase, that is simulation. So before the radiation actually starts, we don't just turn on the machine. We first do something called simulation. So simulation is nothing but the practice setup session before actual radiation delivery starts. Now, it is a process of identifying the abnormal target anatomy, like that is the tumor, or identifying nearby normal structures that we have to protect. Also taking images needed to build the best treatment plan. In simple word, simulation is where we map everything before the treatment begins. Okay, now simulation also, similar to the planning, can be classified into three. That is simple, intermediate, and complex. Okay, it is also classified into these three levels. Now, simulation is automatically considered as complex no matter how many body areas are treated if it involves the following. Number one, particle therapy. Number two, rotation or arc therapy. Number three, complex or custom blocking. Number four, brachytherapy simulation. Number five, hypothermia probe verification. Number six, any use of contrast. So if the simulation involves any of these, it will automatically qualifies for a complex simulation, right? If none of those applies, the complexity will be based on the number of treatment areas. So if one area is treated, that would be considered as simple simulation. If two areas is treated, that would be considered as a intermediate simulation. And if three or more areas are treated, that would be considered as a complex simulation. So these are three levels of simulation. All right. Are we good, coders? Let me know in the chat. So we have covered the consultation, we have covered the planning, we have covered the simulation. And next comes the treatment area. Okay. So CPT also, I just want to explain this to you all. The CPT gives clear understanding or clear guidance on what a treatment area means. So treatment area is a contagious anatomic location that is treated with radiation. Now let's simplify it. So contagious means the areas are connected or directly next to each other. For example, let's say a patient receiving radiation therapy to the breast. Okay, so radiation therapy is received at the breast, supraclavicular area, and internal mammary nodes, as you can see in the image. Now, this is considered as one treatment area because all these areas are contagious and they are the part of the same connected anatomic areas. Now let's look into the next scenario or next example where the patient has metastasis in the femur and the cervical spine. Now they are completely separate body region, right? You can see that in the image itself. And here in this scenario, each site would be considered as separate treatment areas. All right. All right, coders. Now it's time to discuss about the medical radiation physics and dosimetry. This is all about the math portion of the radiation oncology. So dosimetry means the basic calculation of the radiation dose. So let's say the doctor prescribes a 50 gray of radiation. Okay, so we can just type 50 gray into the machine and press the start button. Absolutely not. We can't do that because the radiation doesn't travel in a straight line or in a simple path. It will pass through the skin, fat, muscle, bone, and sometimes the air cavity, right? So each of these tissues will absorb the radiation differently. And it's important that we calculate how much radiation energy travels or how much dose reaches the tumor and how much dose reaches the normal tissue. And that entire calculation process is called as the dosimetry, right? Okay, so basic dosimetry calculations are reported with the code 77300 and special dosimetry calculation is reported with the code 77331. Now let's talk about the ISO dose planning. Now this is not just calculating dose. This is designing how the dose is distributed inside the body. So during the ISO dose planning, we decide the beam angle, port arrangement, wedge blocks, and how the radiation field is shaped. And you can see different ISO dose planning codes. You have 77295. This is for three-dimensional radiotherapy plan. You have IMRT isodose plan, then we have the teletherapy isodose plan, brachytherapy isodose plan, and the special, the special teletherapy port plan as well. So these are all the isodose planning codes, right? Now, okay, now the medical radiation physics section also details about the device, blocks, and wedges and molds used. So treatment devices are the tools that is used during the radiation therapy to shape the radiation beam, protect the normal tissue, and position or immobilize the patient. So yes, so you can see the different codes that is used for treatment devices 77332 to 77334, and these are also classified into different levels like simple, intermediate, and complex. And you will see the term block in these codes. So what is a block? Block is nothing but a shield that is used to protect the normal tissues from the radiation. You can see that in the image, example for the block. So it blocks a part of the radiation beam so that it doesn't hit or it doesn't destroy the other healthy organs. And you will also see the term which is known as bolus. So bolus is a material that is placed on the skin during the radiation treatment. So these are all devices, different devices used to protect or shield the normal body areas, okay, the healthy body areas. And in 77338 you will see that is for a multi-leaf collimator device. So MLC or multi-leaf collimator is a device that is inside the radiation machine, which is made up of thin metal leaves, and these leaves moves independently and they will shape the radiation beam. So that's the purpose of an MLC. All right. Okay. And it can be coded using 77338. Great. Okay, Curtis. So this is an overview of the radiation physics and dosimetry and the device codes. You can see the codes for the treatment plans. I have done a little bit churning here. You can see the codes that is used for calculations and special measurements. And also you can see the treatment device code, also the physics oversight and special consultation codes. All right. Yes. So a little bit churning done over here. Okay. All right. So let's move on to the next phase. That is the radiation treatment delivery. So before I move on to the radiation treatment delivery, I want to show you all some definitions that CPT has given. And it is important to know these definitions because you will see all these terms in the upcoming slides. Okay. So let's begin with isocenter. What's an isocenter? So isocenter is a central reference point of the radiation machine. So it is exact point where the radiation beams meet. So before the radiation treatment starts, the patient is positioned so that the tumor lines up exactly with this isocenter. All right. And because, yeah, so we can take the image to make sure that the alignment is correct as well, because even small movement can affect the accuracy of the radiation delivery. All right. Next is active motion management. Now, active motion management I can easily explain with the help of an example. So consider or imagine we are treating a patient with lung cancer or breast tumor. So here, while radiation during the radiation delivery, the targets will move up and down. You know why? Because patient will be breathing, right? So because of that breathing, the targets will simply move up and down. Now imagine trying to hit a moving target. It is difficult, right? So that's where active motion management comes in. So it will track the tumor during the treatment session. Yes. So this is called as intrafraction tracking. So if the tumor will move out of the position, the machine can pause or adjust. So by doing that, it will help the nearby organs, that is healthy organs, and also this helps for improving the accuracy. So that's a very good technology, the active motion management. And next definition is about the surface guidance. So surface guidance is also similar to the active motion management. In Actually, surface guidance is a technique that is used in active motion management. So instead of tracking the tumor directly inside the body, the system tracks the patient's body surface area, and the camera will monitor the surface contour. So it can be used to see the body movement. So when the patient breathes, the surface moves and the system detects it. So once the body moves, the machine can turn the beam on or off. And this owning and turning the machine on and off is known as gating. And this is also helpful for improving the accuracy and protecting the organs at risk. Okay, so these are the definitions for radiation treatment, some of the key definitions under radiation treatment delivery. All right, so let's move on to the next slide. All right. So, coders, we are moving into the section that deals with actual radiation delivery. So, this is when the radiation is actually or really given to the patient. And these radiation can be of different types like X-ray, electrons, protons, neutrons, and even high energy photons. And you can see the CPT also has given some of definition regarding what a two-dimensional radiation therapy is, or what a three-dimensional conformal radiation therapy, intensity modulated radiation therapy, that is IMRT, and what is an image guided radiation therapy, which is IGRT. So these are the key definitions. You can read them. I'm not going to read them in depth. So these are some of the different methods of radiation therapy. So just keep in mind two dimensional or 2D RT, three dimensional conformal radiation therapy, then you have an IMRT, and image guided radiation therapy, that is IGRT. All right. So, yeah, let's talk about the CPT levels for radiation treatment delivery. So, CPT divides these radiation deliveries into three levels. And here is the most important rule. Here, the complexity is not based on the beam energy. Instead, the complexity is based on the time and effort required to safely drive the treatment. So we have level 1, that is a basic level. So level 1 uses simple 2D therapy or electron field with uniform beam intensity. Then we have level 2, that uses 3D conformal or 3D CRT or IMRT with single ISO sender. So you can see the definition which we saw in the previous slide coming up here, right? The 3D conformal single ISO sender. So for level 2, you can take the example of a patient with the prostate cancer, right? So here all the beam will be aiming at the prostate, which is one ISO center. Okay, so level 3 uses two or more separate ISO centers. So here you can take the example of a prostate and a spot on the pelvic bone that is far from the being the same field. So we can so they have to shift and create another ISO center. So there is two or more ISO center involved. And it is also important to keep in mind that when we use the active motion management along with the 3D, uh, with the 3D CRT, it can be also considered as, or single isocenter therapy, it can be also considered as a level 3 complexity radiation treatment delivery. All right, so we have done with the radiation treatment delivery. Let's move on to another type of radiation treatment delivery, that is stereotactic radiation delivery. So SRS, or stereotactic radiation surgery, is a high precision radiation therapy, and here you can see that in the code language it will be mentioning stereotactic radiation surgery. So don't get confused, there is no cutting involved. Okay, so SRS delivers a high dose with extreme precision in one single session, while other radiation delivery provides small dose in multiple sessions. So here in SRS, they provide high dose in a single session. That's the difference between the other radiation delivery and radiation treatment delivery and SRS. All right. And these are mainly used for cranial lesion, meaning the brain lesion. So if the cranial lesion SRS is done using a cobalt 60 machine, or also known as gamma knife, you would report code 77371. And if we use a linear accelerator based system, you would report 77372. Okay, these two codes are only to be used for SRS on brain lesions. All right. Now, if the same high energy precision technique is used, but for the tumor outside the brain, at those instances, we use SBRT, or stereotactic body radiation therapy. And SBRT also can treat one or more lesion anywhere in the body except the brain, and these entire course does not exceed more than 5 fractions. Okay, so that is about SRS and SBRT. We move on to the next type of radiation therapy, that is surface radiation therapy, or SRT. So SRT is also a type of external radiation therapy, but it uses low energy X-rays, those energy X-rays which is less than 500 kilowatt. Because the energy is low, it does not go deep into the body. Instead, it will deposit mostly on the energies on the skin. And that is the reason why the SRT therapy, or SRT, is used for skin cancers, superficial tumors, lesions close to the skin surface. And SRT is also of two types. One is superficial X-rays, which uses less than 150 kilowatt and penetrates only from 1.5 to 2 centimeter. And we have ortho voltage X-rays that uses greater than 150 and up to 500 kilowatt. So it penetrates a little bit deeper, up to 4 centimeters. So these are two SRT delivery techniques, and you can see the CPT codes as well. They are also arranged accordingly. You have 77436 to 77439. All right, 77436 is used for planning, while 77437 is used for superficial delivery, 77438 is used for ortho voltage delivery, and 77439 is used for image guidance. So these are the codes for the surface radiation therapy. All right. And very important thing to note under SRT is that you do not separately report the treatment planning, simulation, dosimetry, treatment device, isodose planning, or treatment management with these SRT services, because these are included into SRT codes. All right. So they are not reported separately. That's an important point to keep in mind. All right, coders, we are moving to something very different from external beam radiation, and we are talking about the clinical brachytherapy. So brachytherapy means radiation is placed inside or very close to the tumor. So instead of shooting radiation from outside body, we place radioactive source into the tumor or around the tumor or directly near the treatment areas. And you can see the brachytherapy services are reported with code 775 to 77799. And these services include the hospital admission, daily visit. So you don't report these services in along with the clinical brachytherapy codes. All right. And here also complexity is defined by the number and source of the ribbons used, number or source or ribbons used. So if you use 1 to 4 sources, it is called as simple clinical brachytherapy. And if you use 5 to 10, it is intermediate. And if you use greater than 10, that would be considered as a complex. All right. So let's move on. And these are the clinical brachytherapy codes. And we are reaching, or we are arriving at the final phase, that is radiation treatment management. So this is the final phase, and radiation treatment management is the ongoing supervision of patient during the course of radiation therapy. And it is very important to note that the treatment management codes contain only the professional component. All right, these only contain the professional component and not the technical component. So the management codes are only built once in every 5 treatment sessions, or for the every 5 fractions. And these treatment sessions do not have to be consecutive. Okay, so there can be break between these 5 treatment sessions, and that's totally fine. So we have CPT code 77427, which is reported for 3 to 7 treatment session, and 77431 that is reported for 1 to 2 treatment session. Now you might think, why 77427 is used for 3 to 7 treatment session while the code language says that 77427 should be only used for 5 treatment. Okay, this is because 1 or 2 fractions beyond the multiple of fives at the end of the course or treatment are not separately reported, and they are actually included in 77427. So if a patient is taking 6 treatment or 6 fractions or 6 sessions of radiation treatment management, that is included in 77427. If the patient is taking 7 treatment session, that is included in 77427. But if the patient takes a eighth treatment or eighth session, then you can report an additional unit of 77427. All right. So remember, coders, 1 to 2 fractions beyond a multiple of 5 at the end of the course of treatment is not reported separately. And for CPT code 77431, it is reported for 1 to treatment session with a complete course therapy. All right, that term is very important, with a complete course therapy consisting of 1 to 2 fractions. All right. So these are the radiation treatment management codes. You can see 77427 and 431 as we discussed. Then we have radiation treatment management codes for stereotactic radiation treatment. Then we have 77469 for intraoperative radiation treatment management, 77470 for special treatment procedure, and 77499 for unlisted procedure. Okay, so we are going to conclude by discussing about the hypothermia. So hypothermia codes are used in conjunction with the radiation therapy or chemotherapy, and it is not a standalone cancer treatment. Now, here is a science behind hyperthermia. So some cancer cells are resistant to the radiation, but but those same cancer cells are sensitive to the heat. So when we heat the tumor tissues, we make the cancer cells more sensitive to the radiation. In other words, the heat will weaken the cancer cells and radiation will become more effective. Okay. And the coding of the hyperthermia is based on how deep the heat penetrates. So you have the CPT codes listed here. For the superficial hyperthermia, you use code 77600. There the heating depth will be 4 centimeter or less. Then we have deep hypothermia code, which is reported with 77605, where the heating depth is greater than 4 centimeter. And we have 77610, that is for hypothermia generated by interstitial probes, and 77615 is also for hypothermia generated by interstitial probes more than 5 interstitial applicator, and 77620 for hypothermia generated by intracavity probes. All right, so we have learned a lot of things today, right? We have learned a lot of things from the radiation oncology, and it is time to see how much we remember what we have learned. So, coders, are you ready for a coding exercise? Sorry, this is not integrated. This is radiation oncology. Okay, so are you ready, coders? And here is your first scenario. Let's see how much we remember from what we learned. And here's your first question, coders. How should the technical component of this session reported? Option A 77407, option B 77407, 77387 DC, option C 77412, option D 77402, 77387 DC. A patient receives photon radiation treatment delivery to a single ISO center utilizing 3D conformal radiation therapy, that is 3D CRT, without active motion management. And during the session, imaging guidance IGRT is utilized to verify patient's position. How should the technical component of this session reported? All right, coders, your time has already begun. Place your best answers in the chat. Give your best shot from what you have learned. Okay? And all the best. All right, coders, that is time. And how are you all doing? I think you all are still working on the scenario. So go ahead, give your best answers. Don't worry. It's a new topic which we have learned. So give your best answers. Okay, you can see some answers are coming in, and let's see what is going to be the correct one. Okay. So, all right, Coda. So these are what we have in my inventory. So first of all, let's look into the inventory list. I have a photon radiation treatment delivery using 3D CRT. Okay. That is 3D no, conformal radiation therapy. And we have a single ISO center in the scenario. Also image guidance, that is IGRT, also used, right? And these are all our CPT codes. So let's have a look into the definitions first. So if you remember, I said that these services are classified, the radiation treatment delivery services are classified into three categories: level 1, level 2, and level 3. So if you look into the definition of level 2, you can see that it includes any photon therapy delivered with 3D CRT or IMRT to a single ISO center. So yes, we had a photon therapy with 3D CRT and we had a single ISO center, right? So that all matches my inventory list. And it does not also include the active motion management. So it was clearly documented that there was no active motion management involved. So I would say this qualifies for a level 2 treatment delivery, right? Radiation treatment delivery. So I can eliminate 77412, that is for level 3. I can eliminate 77402, that is for a radiation treatment delivery level 1. And the correct CPT code for radiation treatment delivery would be 77407. That is for level 2 single ISO center 3D or IMRT photons, including image guidance when performed. Now, between A and B, the question is, do we have to code 7737387 or not? Right? Okay. So if you read the code language, you can see that image guidance is already included. As well as from the guideline, it also states that, see, the code 77402, 77407, and 77412 includes the technical services of the image guidance. So we don't have to give a 77387, right? So the question also was, how should we report the technical component of this session? So you don't have to bill for the technical component, and the correct answer would be 77407. Awesome job. I can see a correct answer in the chat. So great, great job. All right, Coders, let me know. Did the explanation help? All right, let me know in the chat. So let's move on quickly to the next scenario, exercise number 2. Of the following, which CPT code best describe the encounter? Option A 77280, option B 77285, option C 77290, option D 77295. A patient presents with the radiation therapy simulation. The physician defines the target anatomy for three distinct and separate treatment areas. No contrast material, rotational therapy, or custom blocking is used during the simulation. Okay, of the following, which CPT code best describe the encounter? All right, coders, place your answer in the chat. All right, all right. So I can see some questions in the comments. So we will do some similar scenarios in the upcoming slides, so don't worry. And yeah, even if you get it wrong, don't worry, coders. Don't worry at all. So if you learn something, it's priceless. All right. So participation is the best thing. Okay. So okay, I can see your answers in the chat. Good one. Good choice. Okay, let's see. Let's solve this one together. So here we have in the inventory, we have a patient for radiation therapy simulation. So simulation is what performed here. And simulation was done for three distinct and separate treatment areas, right? So it was clear. We had three treatment areas. And these are the CPT codes. So if you remember, simulation is also classified into three level of complexity, right? Simple, intermediate, and complex. So 77295 is coding for three-dimensional radiation therapy plan. No, we are not at all looking at a radiotherapy plan here. We are coding for simulation. So 77295 is straight away incorrect. And the radiation simulations are default complex if it includes the particle therapy, rotation arc therapy, complex custom blocking, brachytherapy simulation, hyperthermia probe verification, or any use of contrast. So was all these criteria or any of these criteria met in the scenario? Let's look into the question. I don't see any practical therapy used. There was no rotation or arc therapy mentioned, no complex or custom blocking. It was mentioned that there was no contrast, no rotational, no custom blocking, right? So none of these was met. So under the circumstances when these criteria are not met, the complexity is based on number of the treatment areas. So if the simulation is of single treatment area, it would be considered as simple. If it is of two or more treatment areas, that would be intermediate. And if it is three or more treatment area, that would be considered as complex. So let's look how many treatment areas was mentioned in the scenario. So you can see in the inventory, it was mention of three distinct and separate treatment areas. So that means three treatment areas were simulated, right? So that means it qualifies for a complex simulation. And with that information, I can eliminate 77280. That is simple. 77285, that is intermediate. And 77290 is the correct answer. So that is option C. And I can see a lot of option C in the chat. Wonderful, wonderful. Great job. Great job, coders. Awesome. So it's great that you all got it correct this time. And please let me know if the explanation helped or not. Please let me know, please. And we will move on to the next scenario. That is scenario number 3. Of the following, which code best describe the design and construction of the treatment device? Options are option A 77332, option B 77333, option D 77334, option D 77338. A radiation oncologist designs a custom irregular blocks and special shield to protect the patient's healthy tissue during the radiation treatment. Of the following, which best describe the design and construction of the treatment device? All right, Gordon, this is a small one. I think this is a straightforward question. So the clock has already begun. Place your best answers in the chat. Okay. Okay. Thank you for letting me know that the explanation helped. So good job, everyone. You all did a fabulous job. Okay. So go ahead and place your answer for this scenario. All right. I can see answers already coming. I have seen already one answer in the chat. Okay. Let's wait for the others as well. All right, I'm going to stop the timer here. I can see answers are already in the chat. Okay, so I think we have a new member here joining with us. Hi, Isri. Hi there. So glad you are here. Okay, Cody. So let's go ahead. Let's solve this scenario. So I think you all picked up the correct one. So let's do the due diligence, and let's break this one. Break down the scenario. Okay. So in the inventory, I have custom or irregular blocks, and also a special shield was used, right? So you can see 77332 to 77334, as I mentioned in the beginning of the class, that these devices are, or these construction of these devices are classified into three. Okay, treatment device design and constructions are classified into three different levels: simple, intermediate, and complex. And if you look into those parenthetical I would say under the brackets, you can see inside the brackets, you can see the criteria that is required to meet the levels. So for a simple treatment device design and construction, it should use a simple block or a simple bolus. And for the intermediate, you will have multiple blocks, stents, bytes, blocks, and bolus, right? And for the complex, you can see, sorry, complex, you can see it may includes irregular blocks, special shield, compensator, wedges, molds, or cast. And looking at the inventory, I can see it's a complex because it in our inventory we had custom blocks, custom irregular blocks, and the special shield as well. I didn't mention the special shield in the inventory, but it's in the scenario, right? There was irregular blocks and special shield used. Am I correct? So I think it qualifies for a complex treatment device. This is not an MLC device because MLC are used for IMRT, and it's not mentioned here. This is not an MLC device at all. So that makes option C the correct answer. And all I can see in the chat is only option C. So fabulous job, coders. Once again, you all did a fantastic job. So let's move on to the exercise number 4. Here we go. After following, which CPT code describes the delivery of this treatment perfection? Your options are option A 77402, option B 77438, option C 77437, option D 77373. A patient with a basal cell carcinoma on their right arm receives a surface radiation therapy or SRT, and the physician utilizes a ortho voltage X-ray generating 250 kilowatt to penetrate the tissue to a therapeutic depth of 3 centimeter. So of the following, which best describe the delivery of this treatment per fraction? All right, coders, the timer has already begun. Go ahead and give your best answers. You all can do it. You have been doing a great job so far. All right, that is time, coders. Have you all placed the answers in the chat? Okay, so we have 3 more minutes left, so I have one more scenario to cover. So I'm going to walk you through this one. Please continue to work if you're working on this scenario. Please continue, and once you're done, you can please answer in the chat. No worries. Okay. So what do we have here? In the inventory, I have a surface radiation therapy, that is SRT, right? And an ortho voltage X-ray generating 250 kilowatt was used, and the penetrating depth was 3 centimeter. Okay, so we are dealing with the SRT or surface radiation therapy. So the CPT code 77402, that is incorrect. That is incorrect. That's for a standard mega voltage delivery therapy, right? So it's incorrect. We are specifically looking at surface radiation therapy, which is a very low uh, low kilowatt or low voltage, right? So 77402, that's incorrect. 77373, that is also incorrect. That's coding for a stereotatic body radiation therapy. That is also incorrect. We are not looking at a stereotatic body radiation therapy here. So option D is incorrect, option A is incorrect. We are left with option B and C. Let's see what's option B and C are coding for. 77437, option C is coding for a surface radiation therapy, that is your SRT therapy. So far good. Superficial delivery less than less than or equal to 150 kilowatt per fraction, and 77438 is coding for an surface radiation therapy ortho voltage delivery greater than 150 and up to 500 kilowatt per fraction. And you know what, coders? When I look into my inventory, I can see that it was ortho voltage X-ray that was used, and it was generating 250 kilowatt. So that falls exactly under the CPT code 77438 and not 77437. So it eliminates option C, and as you all put it in the chat, it's option B. Option B is the correct answer. Wonderful, wonderful. Everyone got it correct. So great job. Let's move on to the final scenario for the day. So, of the following, which CPT best describe the physician's radiation treatment management? Your options are 77427, option B 77427 times 3, option C 77431 times 9, option D 77427 times 3, 77431. A patient completes full course of radiation therapy consisting of exactly 17 treatment fraction. During the course of treatment, physician provides medical evaluation management including reviewing of port images, dosimetry, and treatment setup. Of the following, which best describe physician's radiation treatment management? Okay, coders, timer has already begun. Place your answers in the chat. All right, Connor. So this is going to be a good scenario. So let me break them down. All right. So in inventory, I have a radiation therapy which had 17 treatment or 17 fractions, right? Or 17 sessions. Okay, so we are coding or we are looking at the codes for a radiation treatment management. And in options, we have two codes. One is 77427, that is for radiation treatment management for 5 treatment session, and 77431, that is for radiation therapy management with complete course of therapy consisting of one or two fractions only. Now, let me pull up my MCG FDR. Yes, this is a MCG facts to remember. And in this, you can see the guideline number 2 that states that 77431 should be only used for the radiation therapy management with complete course of therapy consisting of one or two fractions. Okay, so coders, did this radiation management had only the radiation management course or radiation course had only one or two fractions? No, right? It had 17 fractions. Yes, it had 17 treatment fractions. So can we use code 77431 for this scenario? There you go. Yes, rocking it in the chat. You cannot use 77431. 77431 can only be used when a complete course therapy consists of one or two fractions. And you can read in the parenthetical guideline. It's been clearly mentioned that 77431 is not to be used to fill in the last week of long course of therapy, right? So that means option C is incorrect. I can't use 77431 in this scenario. Also 77 option D 77427 times 3 and 77431, right? We cannot use 77431 for to fill the last week of the course of therapy. So these two options are gone. We are left with option A and option B. Okay, so option A and option B are coding for 77427, while option B is coding for 77427 times 3. Now, you all know that radiation treatment management is reported in the units of 5 fractions or 5 treatment session. So, to code 17 fractions, you divide by 5, right? And that will give you 3 full units covering 15 fractions. Now, with the two fractions left over, what will you do? Because according to the CPT guideline, code 77427 is additionally reported if there are 3 or 4 fractions beyond the multiples of 5, right? So at the end of the course, right? So, however, 1 to 2 fractions beyond the multiple of 5 at the end of the course of treatment are not separately reported. So, because there are only 2 fractions left over, an additional unit is not billable in this scenario. Okay, so the resulting in total of 3 units. So the additional leftover 2 fractions are already included in the 77427. So the final answer would be option B. That is 77427 times 3. Yes, yes, exactly. You got it right. The correct answer would be option B. All right, coders, let me know in the chat. Did the explanation help? Let me know in the chat. Yes. How did you do? Okay, I hope the explanation helped. Okay, yeah. So if there was only 8 fractions used, then you can use additional 77427. So in case if there is only total of 8 fractions used, so you would report 77427 times 2. All right. Okay. So because only 1 and 2 fractions are included, the third one can be reported separately. Okay, I can see some people are still working on. Great, great. You all got it right. Excellent job, coders. Wonderful. Okay, so I hope the explanation helped. All right. So, coders, with that, we come to the end of today's session. It was a great topic. It was a little bit heavy topic, the radiation oncology. So, coders, please don't forget. I will just place the survey link in the chat. Give me a moment. Okay. So survey link is in the chat, coders. Please do fill out the survey form. Please let us know how did we do. Okay, and you can also let us know if you have any questions in mind. Also, let me know if the session was helpful. And if you enjoyed the video, coders, smash that like button, subscribe, and share it with someone who need to see this. Okay, you can share it to your radiology coders. And we will be back. We will be back next week with a new topic, and we will learn something new next week as well. Okay, so till then, coders, stay safe, keep coding, and as I said, please don't forget to fill out the survey form. We'll all see you next week. 4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI, AMCI.